Aloha. Good morning and welcome everyone to Hawaii Care Choices Healthcare Talk Story. My name is Tish, your moderator this morning, and on all of the talk stories, a huge mahalo to all of our listeners that have joined us every single month. We definitely see you. For those of you joining us for the first time today, we are so excited you are here. Happy, beautiful Aloha Wednesday. Let's get started. Today's talk story is being recorded so that you and others may access it in the future. All of our presentations are available on our YouTube channel simply by searching Hawaii Care Choices. Unfortunately, this morning we are not able to go on to Facebook Live due to some technical difficulties, but these presentations will be up on our our YouTube account. So if everyone on Zoom could please click the chat box and say aloha to everyone here and let us know where you are joining from. Today's healthcare talk story, we will be diving in and talking about palliative and hospice care. You may ask questions throughout our entire presentation by clicking on the Q&A box at any time. All right. Apologize. I am also technical support, so we're going to go ahead and flip through this. We are doing polls today. For those of you watching on Facebook Live, you will not be able to see the polls pop up. Oh, excuse me. No Facebook Live. I apologize. So everyone, when a poll pops up, you can select the answer here and submit your answer on the bottom. Just to kick things off, it's been a little rough start, but I'm so glad everyone's with me. I am launching our icebreaker. So if you could be one of these mythical animals, which one would you be? A dragon, a unicorn, a mermaid, or a sphinx? Again, no right or wrong answer. Please choose the one that you think you resonate the most with and click submit. All right, I see them definitely coming in. Thank you so much to everyone that's engaging in our polls. I'm going to go ahead and the poll there and share our results. So if you could be one of these mythical animals, 40% said dragon, 30% said unicorn, 30% said mermaid, and 0% said sphinx. That is that easy. Thank you so much for engaging in our polls. Again, I apologize. Some technical difficulties happening this morning. It is Hump Day Wednesday. I hope you all are just happy to be here. At this time, I'd like to welcome our guest speakers for today. First up, a woman who just celebrated 7 years at Hawaii Care Choices, and she is responsible for educating healthcare providers, medical staffs, patients, and families on the many services offered by Hawaii Care Choices, striving to raise the awareness about palliative, hospice, and bereavement care in hopes to provide a world-class healthcare choices and solutions for all. Please give a warm welcome to Lonnie Weigert. Aloha, Lonnie.
Aloha, everyone. Aloha. Thank you so much for joining us. It's such an honor to have you.
Our second guest is Torrie Fields. She serves as the Chief Executive Officer of Votive Health, a company expanding access to care for people with serious illness by facilitating value-based arrangements between payers and preferred providers. Prior to Votive Health, Fields oversaw serious illness strategy and value-based care at Blue Shield of California and Cambia Health Solutions. Fields' experience has encompassed work as an economist and population health researcher in a variety of settings, including health plans, health delivery systems, and local and federal health departments. She has deep expertise in policy, regulatory change, and holds a master's of public health from Oregon Health and Science University. Please give a warm welcome to Torrie Fields. Aloha and welcome, Torrie.
Aloha, everyone. Thank you so much for having me.
We are so excited to have you both here today. This morning, Lonnie and Torrie will be talking about palliative care and the support you and your loved one may qualify for. Torrie has a wealth of knowledge in public health, and we are so excited to have her share about her current and future insights and how they could benefit you, and how palliative care could be widely accepted, delivered, and paid for in the near future. I'm so excited for you all to be on Healthcare Talk Story. Thank you for riding along in that bumpy road in the beginning. But friends, let's go. And I'm going to hand over the virtual mic to Lonnie Weigert. Aloha, Lonnie.
Thank you so much, Tish. Awesome. Thank you, everyone, for joining us. I am extremely honored to have Torrie joining me. And how we'll be doing this talk story today is I'll be sharing some information, and then we will go to Torrie and get some comments from her. So Torrie will be weaved in and out through the entire presentation, which we are most grateful for. So let's get started, Tish. All right. So for those who are in the audience, what is palliative care? This is what is so interesting to me about palliative care, because if you ask 10 different physicians, you'll probably get 11 different responses on what palliative care is. So it really is an extra layer of specialized care that focuses on relief. So it isn't end-of-life care. It really is this type of care. It's different from routine care, but it's definitely an extra layer of care that specifically focuses on relief. And the goal for palliative care is for those who are dealing with serious illness, who of course will have discomforts that are associated with that, normally due to treatments that they're having. It's really about having palliative care to continue to lead a life of quality still, where you're still doing a lot of things with your family or things that you love to do. And palliative care really allows that bridge to make that happen for people. But most people don't even know that palliative care exists.
Torrie, one of the first questions I'd like to definitely dive in here on is, what have you learned as the economist working in palliative care?
It's really interesting. You know, I think as just a normal person, as you all can see, I'm relatively young. So I'm not usually the person who you would think of as a person in like end of life care or working in hospice care. I actually found out about palliative care after I needed it. I was diagnosed with cancer when I was 19 years old, and I was on my way to medical school. So I thought that I was going to be a doctor somewhere easing suffering. I think I always really thought that focusing on relief was something that resonated with me. But I ended up, instead of going to medical school, I became a patient full-time with cervical cancer. And I thought as a patient that I was getting everything that I needed. I thought that like everything was being offered to me, and it wasn't.
Yeah.
And so I ended up being led through my care. No one asked me what I wanted. Nobody asked me how, or you really even told me what the real side effects from treatment were going to be. And they didn't help my caregiver, who was I would say, a very scared 21-year-old newlywed, my husband. And I thought that my oncologist would manage my pain and symptoms and would focus on my relief, whether that be like my anxiety or my fear of the future or just my standard pain. And I thought that that's how the healthcare system worked. And it wasn't. I ended up finding out only at the end of my treatment what my real side effects were. And I had to go on with my life. I never qualified for hospice, and I was never given somebody to help me navigate. And what I found was that that was the thing that I was more interested in than becoming a doctor. And so on the economic side, as you shared, I actually got my degree in public health, and I started learning about how programs and services are usually not accessible to people because most people don't know about them. And I learned that palliative care was this new model of care for people with serious illness, and that it was actually available to people at my health system where I received treatment, but I was never offered it because I wasn't dying.
Mm.
And that meant that I had a harder time recovering from my treatment, and my caregiver never really got the support he needed. And we really suffered after that. And so, what I've learned as an economist is that we often don't really take into consideration these stories of just standard people. And most people don't know what's available for them because that is what keeps costs low. But if we think about it, what's really necessary is to make sure that people know what's available to them when they are diagnosed with an illness, and they know how to navigate their pain and these new symptoms or side effects you're getting, whether that's from treatment or from the disease itself. And that what that does is actually relieve your anxiety or depression that comes from having that illness. And it is something that I really truly believe that anybody with a serious illness deserves and should get along with their treatment, so that you know what's best for you and you can have that peace of mind to continue on and make the right decisions for yourself. Healthcare is complicated. And for me, I became an economist because I went bankrupt when I had cancer. And I wanted to make sure that people got the things they wanted rather than the things that somebody told them that they needed, because you can't always afford everything you're offered.
Thank you so much for sharing all of that, Torrie, and just you being open about your story as well. I'm going to go ahead and take it back over to Vani. Thank you.
Torrie, oh my gosh, you are a rock star. We could have not asked for anyone better to join us today, because the fact that you're just opening up your heart to us and you are letting us in on that part of your journey really helps the audience understand the importance of palliative care and also the relevance of it, because a lot of times people don't even, well, first of all, people don't even understand what the word palliative means. So that's one of the things. But just as you're sharing the story and us understanding the just rampant misalignment of treatment and care and philosophy of, really listening to what the patient wants is just, it's just incredible that we're covering that today. So we definitely are so honored again to have you in here sharing that with us. So, on our palliative care program, which is called Kupu Care, and again, it focuses on the reason I absolutely love palliative care is because it's the human side of healthcare, where we're going in to truly find out what is important to the patient. Like, tell us, what are your wishes? What are your priorities, etc. And, where we're treating the person, not the illness. And this is the part that I think is just fantastic, that at some point there's an intersection where, the medical side meets the, human nature. It really is incredible. And when you share your story, it's a testament to what is happening here with regard to offering somebody palliative care when they're dealing with serious illness. We find that when people are dealing with serious illnesses, such as those that are listed here on our screen, what would you say, Torrie, is one of the first things that really affects somebody when they are given this news? Like, for your example specifically, you were dealing with cancer, and so what was your first emotion, after you received that devastating diagnosis? Can you share with us?
I was very afraid. I actually, once somebody says that C word, I don't think I heard anything else.
Yeah.
I just heard you have cancer, and immediately my brain went to how long do I have left? And I was so afraid, and I just I felt like I needed to start figuring out what the plan was. I'm a planner mostly, and it was something that was really overwhelming to me, that I needed to be met emotionally rather than physically, rather than like what was going to happen with my treatment. I really needed somebody to check in and ask me how I was, and to see what I needed in that moment, to be able to like listen further.
That makes so much sense, Torrie, because we find that those who, receive their diagnosis, say breast cancer, whatever it may be, their immediate emotion is fear. And we find that with palliative care, the psychosocial need is right there at the top. But without palliative care, a lot of time that need is not even lightly addressed at any point. And so I'm truly grateful for palliative care, and also the idea that it's really a team sport. Like, this is not just happening to the patient, it's happening to the entire family. And so being able to provide something so valuable as palliative care really helps the caregiver and the family as well.
It was
Next
something
slide.
that was so important for me too. My caregiver, I think my caregiver was more afraid than I was. He had to take on all of these new roles, things that he was seeing with my treatment. He was worried about what would happen next for me, but he also saw the changes that I only felt, and he felt helpless. And so what is beautiful about palliative care is that it actually helps to teach the caregiver what their new role is and how to settle into the new life that they're living. And that can really, we don't talk a whole lot about intimacy and keeping that relationship between a caregiver and a patient, but it's so necessary for the trust to stay there and for that relationship to flourish, even when a serious illness is involved.
Thank you so much for sharing that, Torrie. I'm going to take a brief moment and we are going to have a brain teaser. And the question that is up on your screen is, how is palliative and hospice care the same? We just want to get your pulse on this. If you believe that both relieve suffering, both can be delivered in patients' home, both improves the quality of life for patients and their families, or both creates a plan of care, or all of the above. Again, no right or wrong answer. If you could just click the answer you think is best and click submit. All right, I see all those answers coming in. Thank you so much for engaging in our polls. I'm going to go ahead, end it right here, and share the results. So 100% of you said all of the above. Wonderful. Thank you so much again for engaging into our polls. I'm going to turn it right back over to Lonnie and Torrie. Oh, sorry. Go ahead, Lonnie.
Okay, yeah. So anyway, one of the wonderful things about palliative care is that it can definitely be a guide in helping to reduce the pain that's normally associated with anybody that's dealing with a serious illness. And normally it's treatments that people participate in when they have serious illness, such as chemotherapy, radiation, dialysis. Some even have surgery, and then there's discomfort with that. Normally it's pain. This is the thing about palliative care, though, is some people can live with chronic pain for years, and they just do because they don't know that there's something called palliative care that can help them. And this is why these talk stories are so very important, because just making it known where people are aware that they could get this type of care is really a game changer in our community, where we can let people know. And it's largely through education. You know, what Torrie was sharing with us is not only the compassion of care to provide the support, but really to become educated on, okay, so my role as caregiver, or even my role as patient, you know, all of that doesn't just automatically happen. It is provided as part of palliative care. You know, Torrie, can you share with me, being CEO of Votive Health, how did that come about? You know, and how does that role actually affect now your mission with regard to palliative care?
Yeah, thank you for that question. So I'm a health economist, and I've spent a lot of years working with health insurance companies and with payers, or like Medicaid. And one of the things that we really take a look at is, where is the suffering in the system? So when individuals have suffering, you can see that one-on-one. And when you look in the data, healthcare claims, et cetera, you can actually see the suffering in the system. And a lot of that has to do with unwanted or unnecessary treatments, or unwanted or unnecessary hospitalizations. And one of the things that was really interesting to me about 12 years ago, so after I had cancer the first time, was that I was looking in our data at a health insurance company, and I found this crazy thing, which was that people in their last 6 months of life have a lot of hospitalizations, and a lot of people die in the hospital. And when I looked at why they were there, it was for pain and for their symptoms like nausea and vomiting, like anxiety or breathlessness. Things that we know are common things that happen when you have a serious illness. And what's even worse is, have you ever sat in the emergency room when you're really sick? It's not comfortable.
Mm-hmm.
And when you have cancer and you've sat and you're sitting in the emergency room, you're really scared, and it's not comfortable. And so that only increases pain. It only increases all of the bad things for you. And it increases cost, because hospitals are super expensive. So the thing that I found that was really interesting was that if you start to provide palliative care to people with serious illness in their community, where they want to receive care, so in their homes or in a clinic or somewhere that's not the hospital, you can save money. You can reduce all of those times that people spend in a waiting room, waiting for things that they need. And you can sort of prevent these symptoms from becoming a burden on a person and their caregiver. And that is compassionate care. That is what a compassionate system looks like. And it's something that is a win-win situation for everyone: the health insurance company, the health system, and the patient and family. And very rarely do we get something that's a win-win for every person. And so what I started to do was actually work with individual health insurance companies to design these palliative care programs that would more proactively identify people with a serious illness and then get them the care that they need and offer it to them. Because as you said, Lonnie, most people don't know what it is.
Yeah.
So at Votive, what we're doing is we work with health systems and with healthcare payers and insurance companies to design these programs that actually focus on making sure that people have better awareness of what palliative care is, that they know what their options are when they have a serious illness, and they know where to find the high quality providers, the people who actually have something like cuckoo care. and who are offering it in the community, so that you're able to receive these services as a person or a caregiver without really needing to pay for them, because it should just be part of good healthcare.
That is really awesome. You know, in our audience today, we have somebody from United Healthcare, and Randy, not to put you on the spot, but I was wondering if you could share what your experience has been with regard to your members having palliative care. What kind of difference has it made to them in their quality of life? Tish, is he able to unmute?
Yes, I could get
Okay.
that on here real quick. Randy, hold on 1 second.
I think it just makes a good point on what Torrie is sharing right now, that, you know, she actually helps the payers figure out a way to be offering this. Randy, please share. How do you feel palliative care has affected your members? I see that he's on there, but he's still muted.
Yeah, he's on. Randy, if you could just unmute yourself, please, that would be great.
Yay!
Okay, there we go.
Oh,
Oh, I
okay.
think he's having some technical difficulties
Okay,
as well. We
okay, all
apologize.
right, no problem. Let us just move on. It's just wonderful that we're just touching the different points here that Torrie is bringing up, and actually that it is all encompassing. I think the thrill of what Torrie is sharing is that it's a win-win. I mean, how incredible is that for healthcare and all the payers and then the providers as well? I mean, it's just, yeah, it was just a moment that I wanted to celebrate, but it was a selfish moment, I'm sure. Let me continue. So what is another thing about palliative care that is great is that in creating their plan of care, this is where we find out what a patient's values, priorities are, and goals. And so we are not providing them, you know, unwanted or maybe even unneeded treatments. You know, I've definitely been in the exam room with patients and the providers who are sharing with them different options. However, it's so great when we already know what the patient's values, goals, and wants and desires are, because then we can help guide whoever the doctor is on what the patient really wants. So no, the patient doesn't want high dosage chemotherapy or radiation. You know, they're really looking at, you know, what is the current status of their tumor now, and really looking at how they can approach maybe treatment that is not so detrimental to their quality of life. No, see, before palliative care, none of those questions were really asked. It was more told to patients that, well, this is what you're going to need. You got to do this, 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 and this. Okay, well, we'll set up, you know, your appointments and you can come in and just do this. Where now we're like, wait, hold up. Let's just see what the patient really wants. And we have found too that there have been conflict at times within a family because maybe the family wants, you know, aggressive treatment for the patient, but the patient themselves is not wanting that. And so palliative care really puts the brakes on a lot of it, where let's ask the patient, let's really put the patient in the center of all of this. And let's lean into that level of compassion so we can provide that. And it really helps in palliative care that we then guide the patient with the family for their advanced healthcare directive as well, so that everybody knows the true wishes, goals, and priority of the patient.
You know, one thing to share there, I was diagnosed 10 years after my first diagnosis with recurrence, with cancer a second time. And I knew about palliative care the second time. And so when I was diagnosed, my oncologist was the same, my care team was the same, but I was different. And my oncologist tried, when she told me that I had cancer, she scheduled me for an appointment for a surgery right away. And I asked her to wait, and I asked for a palliative care consultation. And at first she didn't want to give it to me because she didn't think that I qualified. And I finally got one. And the thing that was most important for me that I learned, even as a person who worked in palliative care, who knew about palliative care at that point, was just how valuable what you just said, Lonnie, is. I had a social worker who came and sat with me, who asked me if I had any questions about my diagnosis. I'm not a clinician, and so I had some questions. And then she asked me, now that I know about my diagnosis, what were my goals? And I found that my goals were not about healthcare at all. They weren't medical in nature. I was really interested in being able to get back on my bicycle. I was really young. I was 30. And so I was very interested in making sure that I had a good relationship with my body, and that I was able to not always see myself as a patient after I finished treatment. And those are things that were really personal and important to me, that nobody would have been able to see in my chart. Oh, she's a cyclist is just not something I would have told my doctor beforehand. And so what that did was it completely altered my course of treatment. Instead of getting the surgery that would have made me not be able to ride a bike anymore, I got a different type of treatment. And that allowed me to meet my goals. And it allowed me to live a higher quality of life later on as I got better. And I was never able to feel confident enough to put it into words, what I would have needed, or to be able to talk to my doctor about how to change my treatment based on those goals for care. And that was the beauty of the social worker who worked with me on the palliative care team, who spoke for me and was able to translate what I had written down or the plan that we came up with to the medical speak or the clinical speak that my doctor needed to hear. And that completely changed my life.
Thank you so much again, Torrie, for just sharing all of these personal stories. I know it is resonating with others on this call too. One of the questions that I wanted to ask is, what are some things that our insurance companies are doing to improve this access to palliative care?
What I'm really excited about is that as palliative care is a win-win-win for everyone, the more data that come available that say that it's actually really good for patients, it's really good for the health system, and it lowers overall healthcare costs by keeping people out of the hospital. More health insurance companies are offering palliative care before anyone is eligible for hospice. So even if you don't think that it's available to you, more health insurance companies are actually offering that. They're testing it out. They're actually contracting with providers to, like Hawaii Care Choices, to be able to deliver these services while you're still receiving treatment.
Yeah.
And in addition to that, they're educating their staff at the insurance company about what palliative care is, so that the nurses and doctors who work at insurance companies also understand the value of palliative care and are able to make referrals and to help people get access to really necessary services. I'm really excited about Hawaii in general. I have been able to start working with the state of Hawaii, and they're the biggest insurance company in Hawaii, delivering care to people who are receiving Medicaid. And they actually want to formalize palliative care as a benefit that's available to everyone that has a serious illness. And so they believe that this is important, and it's a really necessary part of care to give people access to. And that only, lifts all boats. It only makes things better for everyone when they're able to receive more access.
Yes, absolutely. We have a question coming in from Aubrey in the audience. She said, "Aloha, Torrie. I have been working on access to medical aid in dying. Now that Hawaii has authorized it, we see a huge palliative aspect to medical aid in dying. What are your thoughts on that?"
It's a really great question. I think that palliative care is something that is important in making sure that it's helping manage people's pain and symptoms, and that it's offering all of the options available to a person with a serious illness. And medical aid in dying is one of those options that's available for people. It's something that can be chosen. And I'm actually going through a situation personally as a caregiver where my loved one has dementia, and it's not eligible. She's not eligible for it, and it's not in her state. And it's something where, you can watch somebody suffer without that option being available to them. But what's even more important is to make sure that people are making sound decisions. And before they choose medical aid in dying, they receive the management of their pain and symptoms and are able to receive really high quality health care while they're still pursuing other options. And so without palliative care, medical aid in dying can become a little bit of, I would say, an ethical challenge.
Thank you so much for sharing your thoughts on that, Torrie. Thank you, Aubrey, for sending in your questions. Back to you, Lonnie.
So as part of palliative care, what we found is it really is about the entire family, or whoever is in the family unit will be experiencing the illness as well. And so just like Torrie was saying, her caregiver was actually impacted maybe even a bit more than she was. And it's because our caregivers are dealing with the fear and anxiety and all of that as well. And so palliative care does provide the support and care for the caregivers, and that largely comes through education. So this is what happens is, without palliative care, somebody who's dealing with a serious illness, maybe COPD or CHF, and all of a sudden they can't breathe. Well, their anxiety just goes up and right through the roof, and they immediately call 911 and they head out to the emergency room. When there's palliative care and the nurse has come in, as well as a social worker, and has provided the caregiver and the patient with education, particularly around dealing with their symptoms. Oftentimes, the caregiver can say, "Oh, no, remember now, when you can't breathe, we're supposed to take your medicine. We're supposed to wait 5 minutes. You're supposed to drink water, whatever." And then we wait and then see if it goes away. And what we found is that because they are equipped with the information, they don't have so much anxiety where they have to immediately move to, "We got to go to the emergency, we got to go." It's more like, we've been taught some different tools. We've been given different ways to deal with this. Let's try that first. And once they've achieved that, then they feel like, "I think we got this. Let's keep going." And this is where Torrie is bringing up about there is savings in palliative care, because people are not just whisking themselves out to the emergency room and using the ambulance and all of these high cost items for care, when in fact, It just took a little education and a few deep breaths, and we were apparently saving everybody a lot of money. So for anyone who's dealing with serious illness, I say, get the early care so you can get the early relief. It is most of the people that I talk to after, no matter what stage they're at, they will normally say they wish that they had called earlier, but they just didn't know. Or if they did know, they were reluctant because there were several different reasons that they didn't want to call. One, some were embarrassed. They just didn't want to call because, no, we're embarrassed because we were raised to believe that we need to take care of our own family, and we should not be calling a stranger to come into our home to help us with that. Shame on us. We're supposed to be able to take care of mom, uncle, or whoever it is. And so as a result, we're not going to call. Well, newsflash, everyone, that's definitely a myth buster that I'd like you to know, that it's actually better if you call for the help, because wouldn't you want the experts to come in and help you take care of your loved one? And also, it allows the caregiver to be who they are, especially during the times that they're receiving support. Meaning, if that was my mom, I would be so very grateful to the care team that comes in to help me, because I can actually be a better daughter to my mom during that time.
Absolutely. And on the topic of caregivers, Torrie, we know that caregivers are such a necessary part of the delivery of care. What do you feel, what services should be available for caregivers?
One of the interesting data points that I read long time ago was that caregivers are really taking on the big burden of healthcare delivery in this country. And more than 50% of the population of caregivers report never having been trained to do this new job that they're being given. And just like when you're diagnosed with a serious illness, you don't really think ahead for that diagnosis because you just don't know what's going to happen. You are thrust into a position as a caregiver, into a new role without really understanding what that is. And so even when there is that cultural feeling of I need to take care of my loved one and I shouldn't be asking a stranger, you still need to be equipped with the training of how to be that care person for them. And there are a lot of new medical things that go on when somebody's receiving treatment, and caregivers really should be trained and be given the service of education and of training to be able to feel confident with those skills. And the other thing is really around respite care. As Lonnie was sharing, there's a lot of thought that you need to be able to take care of your loved one. I don't think that anybody signs up to take care of their loved one 24 hours a day, 7 days a week, 365 days a year. And everyone deserves respite and needs to be able to put their oxygen mask on themselves before they're able to really successfully do that for someone else. And so respite care is one of those types of services that make sure that you also get the care you need as a caregiver so that you can breathe and that you can go back in there and be a high functioning, high quality, present person for your loved one, and are able to maintain that dignity in being able to deliver care to another person. Those things are really necessary, and respite care can take lots of different forms. Things like helping doing grocery shopping, or helping doing house cleaning, or helping with cooking meals at home, and can be delivered by lots of different types of folks in the community, or can be covered by healthcare or health insurance. And we see a lot more of that being covered because it's so necessary to support that caregiver who's just there day in, day out, taking care of everything.
Yes, I really like that analogy that you said. We have to put our oxygen mask on first so that we are able to give that care to someone else. I'm going to pause right here and we're going to switch over to a quick brain teaser. I'm going to go ahead and hear that bell. And the question up on your screen is early patient sign up ensures more support and quality of life for all, true or false? Again, there's no right or wrong answer. We just want to get your opinion on it. And we are sharing so much about palliative care and caregivers. If anyone anyone listening right now, if you want to give Torrie a question, please go ahead and put that in the Q&A box or even in the chat. All right, thank you so much for engaging into our polls. I'm going to go ahead and end the poll there and share the results. So 100% of you said true. Early patient sign up ensures more support and quality of life for all. Again, thank you so much in engaging in our polls. We're going to go back to Lonnie.
Oh, thank you, everyone. Oh, I couldn't have said it any better, Torrie. That was just really awesome with regard to the caregiver part. I mean, we see caregivers, coming into the doctor's offices and they look oftentimes more frail than the patient. So you couldn't have said it any better, Torrie, and how you were sharing it. Thank you so much. Now, when people are on palliative care, there does become a time in their journey that they could need a higher level of care. And when that time comes, they could absolutely need hospice care. And this is when they feel, the patient feels, based on their plan of care and their goals, their priorities, their wants and desires, that no, I'm done with curative treatments. I don't want any of that. Now I just want to rethink my values and goals, and I just want to spend more time being comfortable and being with those I love, doing the things that I really enjoy. And so for those who might need to, when it's time to transition, normally that happens because they no longer want any type of treatments. They're able to get a 6-month best guesstimate from their primary care physician of life expectancy. And also, it's really where the highest level of palliative care now, which is called hospice care, comes into play.
So Torrie, we talked a little bit about the caregivers and how they can access, different services. I'd like to ask, how does palliative care layer into the services that the patient can get in the community? We know respite's not only for the caregiver, but also for the patient as well, or maybe some home and community-based services?
Yeah, I think that it's the first thing about hospice is that hospice is, as it says here on the screen, hospice is the highest level of palliative care. So that's one thing that's really special and important. Hospice is the highest quality provision of service I've ever seen in healthcare. It is a beautiful service that should be made available to more people. And so often we see people receiving hospice care too late in their journey of a serious illness. And palliative care, the way that it layers in is that it helps people when they're still receiving treatments and can really help to create that smooth transition so that people are receiving hospice care for a much longer period of time, and you're able to keep the same care team who's been helping you all along. And that means that you have a really trusted relationship with your providers. And what's also really great about hospice is that it's tightly coordinated. So the hospice providers can actually help to make sure that you get everything you need and it's all under one umbrella and that things are really coordinated. Palliative care is upstream from that. And it's something where there are all of these other options that need to be coordinated sort of separately. So respite care is one of those that provides relief to a family, where there are services that can be performed that help to aid the caregiver There are other services under home and community-based services like transportation, so that you don't actually have to go in an ambulance to your appointments, or you can actually get help with getting from here to there. Home and community-based services also helps to take care of other basic needs like food delivery and making sure that you get meals that are nutritious and that are related to the diet or the new diet that you have to pursue when you have a serious illness. And these all really layer in to be able to support everybody holistically on the medical, the psychosocial, and on the basic needs that you need to just, have your everyday life. Hospice is something that when you see people receive palliative care, they actually get more hospice care. There are more people who start to ask for it, who receive hospice care when they wouldn't previously, and who receive it for a longer period of time, which is really, really important.
Thank you so much, Torrie. I so appreciate all of your wealth of knowledge that is being shared here today. Lonnie, I'm going to pass the virtual microphone over to you.
Thank you again, Torrie. That was really great. I just wanted to share with everyone that, these are all the payers that Torrie works with as well. And for palliative care, right now, a lot of the payers are trying to figure out how they might be able to package it like they do hospice care. But until then, many of them will pay for certain aspects of palliative care, often as a copay, similar to when you visit a doctor, whenever maybe the APRN comes to visit, or the licensed social worker comes to visit when somebody is dealing with palliative care. However, on hospice, the beauty of hospice care is that for the most part, it's 100% paid for when you have hospice care at home. And that also includes any medications that are associated with the diagnosis that someone receives when they come into hospice. So hospice, just as Torrie was sharing, is quite a robust program. And the earlier that somebody signs up for it and is qualified to get it, I mean, the better for them. We have had patients that have graduated from hospice over years span, and then they come back when they need that higher level of care again, and then maybe they graduate again. It is amazingly incredible how that focus that is placed upon the patient, how it truly reduces the dis-ease that they are dealing with, and sometimes are able to graduate out of hospice care for a moment before they need us again. So again, that message that Torrie gave, the earlier the better, because you can be in hospice care and receive all those robust services for a much longer period of time.
Yes, thank you so much, Torrie and Lonnie, for your explanations on palliative care and how it can help. I'm so thankful to Torrie for answering all of our questions that came in. Thank you to our audience for engaging in our polls and sending in your questions as well. If you would like to connect with us, you can call us at 969-1733. You can also email us at care@hawaiicarechoices.org, or you can ask your doctor if palliative care is right for you. If you have any specific questions about you or your loved one's situation, please reach out to us. We have a wonderful team that is on standby to answer any of your questions. And like Lonnie said, our hope is that you receive the right care at the right time. I know we are at 10:58 at the moment, but I'd just like to see if everyone can take a 6-question survey that will be showing up on your screen right now. Again, no right or wrong answers. If you can just click all 6 questions and click the submit button below. This survey is anonymous. It will not be shared, and it just helps us to gain more knowledge in gaining a better understanding on how we can best serve the community with presentations like these in the future. Everyone is invited to next month's Fully Engaged Zoom presentation. You can just email me at llopez@hawaiicarechoices.org or check into our website again, hawaiicarechoices.org /healthcare talk story to register. Torrie, I'd just like to say thank you so much again for your valuable insights. And we're so thankful that you took the time out to share this with our audience, and your personal stories are just incredible to hear. We so appreciate your vulnerability and being able to share that with all of our listeners today. I know you have some wonderful notes inside of our chat, but I'd just like to ask if you could let us know what anybody can do to advocate for palliative care.
Well, thank you very much for having me. It's just been a pleasure and an honor to get to know Hawaii Care Choices over time. The first thing is to ask for palliative care. That is really important. Every community member plays a role in identifying their own needs and in saying, look, I have a serious illness, or my loved one has a serious illness, and palliative care would be important for me or for my family. The more we educate our doctors, the more they refer to services. And that is so important. Is also talk to your insurance company. If you think that you are eligible or appropriate for palliative care services, I'd encourage you to call your insurance company and find out if it's covered. And if it is, you'll get it. And if it's not, they'll get to be educated on the importance of palliative care. And I want to thank you, Randy, for sharing the importance of palliative care as a care coordinator. And the more available these services are, the more effective Randy can be at his job or her job. So really, it's important to advocate and to ask for services and to access them accordingly, so that people know that it's important and it's available and that people really need it.
Wonderful. Thank you so much for that. So you heard it here, listeners, just asked. Torrie, if you have just a quick minute, I'd like to share a wonderful note from Brenda Ho, our CEO of Hawaii Care Choices. She says, Torrie, thank you for honoring our work with your participation in this healthcare talk story and for sharing your very personal and meaningful experience. Thank you for applying your personal and professional knowledge and expertise to the advancement of palliative care in our nation. You are a gift to us, to all that are needing this support now and even in the future. So grateful. Another note from Randy. He said, Kupu Care has been absolutely invaluable for the members that I am health coordinator throughout UHC, and Kupu Care assists us in helping people live healthier lives through their individual challenges. So again, so appreciative that you took your time out to come on and not only share your professional expertise, but your personal stories as well. Thank you, everyone who has been on this call and listening. If you want to listen to this again, it will be up on our YouTube channel. Just search Hawaii Care Choices on YouTube, and it shall be up by the end of this week. If you feel that you have benefited from this presentation, please let your friends and family know. We do this healthcare talk story on the 10th of every month at 10 o'clock. Mahalo again for joining us. See you next month. Aloha.
Aloha, everyone. Thank you.
Aloha.